In this video, we'll discuss about blind loop syndrome. So, blind loop syndrome is also called as stagnant loop syndrome or small intestine stasis syndrome. So, basically, it is a small intestinal abnormality associated with overgrowth of bacteria, outgrowth of bacteria causing steatorrhea and vitamin B12 malabsorption, both of which improve dramatically after oral antibiotic therapy. Now, coming on to the etiology, just remember mnemonic. Suppose someone has a GF and her birthday is there. So, basically, GF's happy birthday. Okay, so first coming on to G. So, by G, we have gastric surgery or achlorhydria. Achlorhydria. By F, we have fistula. It can be gastrocolic or enterocolic. Then by H, we have hypogammaglobulinemia. Alright, then by B, we have bowel resection. Then by D, we have diverticulosis of small intestine. Alright, now what is the mechanism? In mechanism, what we see is there is microbial overgrowth. Okay, so yeah, so there is microbial overgrowth. Now this leads to deconjugation of bile salts, then microbial uptake of nutrients, and at last mucosal damage. Now in the clinical features, what we will write is we will write steatorrhea, we'll write diarrhea, vitamin B12 malabsorption. So anemia. In diagnosis, we will demonstrate the organisms in the duodenal aspirate, then reversal of malabsorption of fat and vitamin B12 by broad spectrum antibiotics in a week. Also, demonstration of causative lesions, fistula, diverticulosis by barium meal study. Now coming on to the treatment. In treatment, as I told before, we will give oral antibiotic therapy. So basically oxytetracycline, that is in a dose of 250 to 500 milligrams 6 hourly. Now the response will come in 3 to 4 days, in which the steatorrhea will disappear. Then it is continued for 7 to 10 days. Also oral vitamin B12 supplements because there is malabsorption. Then if not cured, we will do the surgical resection. Now the area to which it is localized is basically removed. So this is blind loop syndrome. I hope you understood. Thanks for watching.